All right, now we need to finish out the process of digestion with the large intestine and defecation. So the large intestine is going to contain the cecum, the colon, and the rectum, as well as the anal canal. The large intestine is called such because it is much larger in diameter than the small intestine, but it is significantly shorter in length. The cecum is going to be the very first portion of the large intestine. The vermiform appendix is a projection off of the cecum. It's going to be responsible for fighting infections. However, there is the potential for the homeostatic imbalance called appendicitis. This is when you have an inflamed appendix, which can cause peritonitis, a life-threatening infection of the peritoneum. The next portion is going to be the colon. The colon is going to include the ascending colon, which goes up the right side of the body, the transverse colon, which goes across the abdominal cavity, and the descending colon, which is going to pass down the left side, and the sigmoid colon, which is going to be this final S-shaped region of the colon, which is going to enter into the rectum, and it's the last portion of the large intestine. The rectum is going to open into the anus, where defecation or the expulsion of feces is going to occur. So here is just those main portions of the colon. You should be at least a little bit familiar with what these different regions are called. We have the ascending colon, transverse colon, descending colon, sigmoid colon, rectum, and anus. So we do want to talk a little bit about the functions of the large intestine. The large intestine is not responsible for producing digestive enzymes. So it does not produce digestive enzymes. It does not absorb nutrients, except a few vitamins. But what it does do is absorb water from feces to prevent dehydration. It also absorbs vitamins produced by the intestinal flora, the bacteria that inhabit the intestines. Those bacteria are going to break down the indigestible material and produce B-complex vitamins and vitamin K. It's also going to be responsible for forming feces. Feces is like 3/4 water, 1/4 solid waste. Bacteria and dietary fiber, that indigestible remains, make up those solid wastes. Bacteria digesting the indigestible materials cause the odor of feces and accounts for the production of gas. Stercobilin is a breakdown product of bilirubin, and oxidized iron can causes the brown color of feces. Now, defecation is the process of ridding the body of feces. Again, we're going to use that wave-like motion known as peristalsis to force the feces into the rectum, out of the large intestine into the rectum. Stretching of the rectal wall initiates nerve impulses to the spinal cord. Then the rectal muscles will contract and the anal sphincters will relax, allowing the feces to exit the body through the anus. It can inhibit defecation by contracting the external anal sphincter, which is going to be made out of skeletal muscle. And if you remember from our discussion about different muscle types, skeletal muscle is the muscle that we have voluntary control over. Now, there are quite a few potential homeostatic imbalances with the colon and rectum. As we stated earlier, diarrhea is caused by increased peristalsis and failure to absorb water from the feces. So either we're moving the food too quickly and we're not absorbing the water from them, or there is potentially an infection or nervous stimulation that's causing that peristalsis. Now, constipation is dry, hard feces, which is caused by sort of the slow movement. We're absorbing too much water out of the feces. Now, this can usually be fixed by ingesting more fiber, that indigestible cellulose that we cannot break down, or water, increasing our water intake. Hemorrhoids are enlarged, inflamed blood vessels of the anus due to chronic constipation, pregnancy, aging, anal intercourse. Diverticulosis is pouches or weak spots in the muscularis layer of the large intestine. Diverticulosis is in itself is not threatening, but it can be if feces builds up in those little pouches and causes infection of the large intestine. Irritable bowel syndrome, or IBS, also known as spastic colon. The muscularis contracts powerfully but without normal coordination. So some of those symptoms include abdominal cramps, gas, constipation, urgent and explosive stools. All of those are seen in irritable bowel syndrome. Irritable bowel syndrome, not irritable bowel syndrome, inflammatory bowel disease can include ulcerative colitis, which infects the large intestines and rectums, could result in diarrhea, rectal bleeding, abdominal cramps, the urgency to defecate. Crohn's disease, you may see, I don't know, I feel like every time I turn on the TV, I'm seeing advertisements for different medications for Crohn's disease, but this is usually occurring in the small intestine. Ulcers are forming in the intestinal wall. They can be very painful and they can bleed as they erode the submucosal layer where those nerves and blood vessels are found. In this case of Crohn's disease, you're not absorbing nutrients in the affected areas, and some of those symptoms can include diarrhea, weight loss, abdominal cramping, anemia, bleeding, and malnutrition. There's also the potential to form polyps. Polyps are small growths found in the colon lining. For the most part, they can be benign, but they do have the potential to turn cancerous. If colon cancer is detected while still confined to a polyp, the expected outcome is complete cure. All you have to do is simply remove that polyp. If, however, it has spread to other areas of the body, or if it has spread to the circulatory system, colon cancer can be pretty risky. Increased dietary fat raises the risk of colon cancer. Fiber in the diet can inhibit colon cancer, and regular elimination reduces the time that the colon wall is exposed to cancer-promoting agents in the feces. So it's important to maintain a regular diet high in fiber to help prevent or stave off colon cancer. All right, you should be able to describe the parts of the large intestines and the functions for each, and explain the role of the large intestine in the digestive tract, and explain how constipation and diarrhea are related to the large intestine.